Hey mamas, welcome to another expert chat by Mothers Yoga. For today's chat, we are talking about protecting your pelvic floor for life. So it's such an important topic, and very rarely we have someone really take us through the basics and what's the correct way to strengthen it. What are some of the symptoms you need to look out for, and how do you recover and strengthen your pelvic floor after childbirth? So, to talk to us about this topic, we have Michelle from Be Your Best Physiotherapy, who is an incontinence and also a pelvic floor physiotherapist. And we are so excited to have her here to talk to our members and listeners about this topic that is so important. So, I'm so excited to have you, Michelle. Thank you so much for joining us.
Thank you
And
for
would
the
you
opportunity.
Thank you. Would you like to let our listeners know a little bit about you and what do you do?
Yes, I'm a pelvic floor physio here in Cranbourne. We have a bit of a mixed practice, so we do normal physio, neck and back pain and things, but we also specialise in pregnancy and postnatal care and pelvic floor rehab.
Yeah, and I'm very excited because Michelle did help me in my own pregnancy with a bit of pubic symphysis pain and also strengthening my own pelvic floor. So thanks, Michelle. So kicking, wonderful. So kicking off today's discussion, and Michelle has got a wonderful presentation for us. So what is exactly pelvic floor? What is this muscle? And mostly because it's internal, we don't really see it. Sometimes people are not able to visualize what it is like. So I would really like to know from you, like, what is pelvic floor? If you have a model, please show us like where the pelvic floor is and what does it look like. So
no worries. If I could share my screen and then we can. So your pelvic floor, like you said, is tricky because you can't see it. It sits at the base of our pelvis, so that's why it is facing the floor and it is holding everything up above it. It's a layer of muscles and connective tissue slinging from the bones on each side, so our pubic bone at the front to our coccyx at the back, and then the ischial tuberosity or our sit bones on the side, and it's a big sling of muscles that is supporting us. So the more pressure or weight we have from above, or the more strain we have from above, the harder these muscles have to work.
Yeah.
I guess the reason why I'm very passionate about pelvic floor physio is because in Australia, 1 in 3 Australian women who have a baby are leaking. So yes, in your group of 3 friends, 1 out of 3 are leaking when they're doing daily tasks. 1 in 2 Australian women have prolapse. So we'll talk about that later, what that is. But that is when there is strain on your pelvis. So every second person you know has a prolapse here in Australia, which again is a frightening number, but not spoken about. And then I also see a lot of people here with pelvic floor too tight. So we'll talk about that as well, which again is very common. 1 in 5 women have pelvic pain. Common question people ask me, do men have pelvic floor muscles? They do, but they don't use them. So we have a pelvis that is open at the bottom and we have to use our muscles from birth to gain our continence. But boys have a prostate, so the prostate provides pressure, so they don't really have to use their muscles too much unless they end up with prostate cancer and losing their prostate. So yes, boys do have pelvic floor, but they don't have to use them all the time like we do.
Interesting.
I guess the other thing, the other reason I'm very passionate about pelvic floor is also thinking about over time. It's not just about now and keeping symptom free when we're having babies and postnatally, but for the future. So if you look at that bottom graph there, time from the birth, 10 years later, 20 years later, 30 years later, the blue is the people having Caesars and their rates of prolapse as time goes on. And the purple is the people having a vaginal delivery. So 25, 30 years post delivery, that is when prolapses become extremely common. It's a frightening graph, that one.
Okay, so when they say that people who deliver vaginally are more prone to these symptoms, there is some truth in that.
Yes.
Yes, compared to cesarean.
Relatively newly understood, so this is pretty new research. So yes, there is consequences later on.
Okay, interesting.
So what happens to your pelvic floor in childbirth? If you're looking at this picture at the bottom, your pelvic floor has to stretch to 1.5 or 3 times their normal length. If you think about a footballer stretching or straining their muscle on the footy field, they don't even go to 1.1 times the length. And when we deliver babies, we need to stretch ours to 1.5 or 3 times the length. And then it takes time in postnatal recovery to come back to the normal length and the normal strength. But unfortunately for some people, they can end up with a tear where it doesn't come back together, or a tear of the bone can happen as well. So I have put down the statistics on that one because it sounds more scary than it is. So a perineal tear is the tear to the tissue underneath. It can be the skin, it can be the muscles and the connective tissue, and it can come just around the vagina, so that's a grade 1 or 2 tear. But unfortunately, it can go into your bottom, into your anal sphincter as well. So in Australia, the latest research we have for 2016, 4 out of every 100 births in Australia in 2016 had a tear that went all the way to their bottom, into their anus.
Okay.
So, yes, and they did some research to try and figure out why that happens and what we can do better. So the risk factors for a bigger tear is the first baby. So people usually do have a bigger injury on their first baby.
Okay.
Mother's ethnicity. So Asian women are more likely to have a bigger tear. Larger baby, more likely to have a bigger tear. And then if intervention's required, so episiotomies, forceps and suction, or if you've torn before, they all risk factors to make it more likely that you will have a tear when delivering a baby. So we have to stretch. We're aiming for minimal tear is what our goal is in the delivery. Okay. And that is the work we're doing in pregnancy, in our muscles and our fitness leading up to delivery will make a difference to that as well.
Yeah. So we'll come to that part where, the next slide does show preventing perineal tear. Yeah, interesting.
So what we can do is perineal massage. So that research only looks at the first birth, but actually using perineal massage reduce the risk of tearing and reduce the risk of episiotomy. So our number one goal when we're delivering our baby is to try and have a vaginal delivery with no instruments. And our worst outcome would be vaginal delivery needing instruments. It does increase our risk for the future. Okay. The perineal massage we teach in physio, but we only do it in the last few weeks. As we were saying before, when you're pregnant and trying to get through life and hold it all together, we don't want to be overstretching the muscles in the pregnancy, but in the final stages, when you finish work, you're off your feet more, that's when we could do the perineal massage at the end.
Is it generally after 36 weeks that it's recommended?
Yes, unless you know that you're going to be going particularly early. But as soon as we start doing that stretching, we need to slow down on our feet. Otherwise, we're not going to be able to maintain our continence and function at the same time. Okay. Yep. Some obstetricians recommend a device called an Epino, but there's no research that is any better than just doing digital or using your own fingers to stretch the muscles, which, yes, that's what women's health physios teach. Yeah. But yes, the device is no better. Okay. This is interesting. What kind of device is it? Is it just like a wand that you use to Yes, with a very big head, and it's trying to mimic like what the head of the baby is going to do in the delivery. Okay. Yeah. But no research evidence better than just doing the digital stretching. Okay. Birthing position reduces your risk of tear, so trying to be upright and trying to stay on all fours or squatting rather than lying on your back with the legs in the stirrups. So being more upright, letting gravity do the work reduces the risk of tearing below. Okay. Another common strategy used is hot packs on the perineum in the delivery, but no research evidence that it does anything at this stage, but certainly it's common practice in a few hospitals. The midwife holding on to the muscles as the baby's head is coming through, but again, there's not much research evidence on that. But the last one that I've highlighted there is education and discussion prior to birth. Unfortunately, I meet lots of people after the baby is born, after the trauma has happened, and they say, oh my gosh, I've learned so much since the delivery that this shouldn't have happened and I should have done this, and unfortunately can't take back time. So education and chatting to care providers before the delivery about what could happen, what are your options, is actually one of the biggest biggest ways to prevent injury.
Yeah.
So being aware that injury can happen and then asking the questions. But if you don't know that it can happen, I guess that's when you don't know to ask the right questions. So the government is doing a big campaign to all hospitals that deliver babies to try and increase that, because that is, there's research that just having that discussion reduces the injury.
Okay. What kind of campaign is this, Michelle? Is it specifically birth education or?
No, so it's educating the obstetrician, midwives and nurses and physios, and making it more of a holistic approach, everyone working together to try and get the best outcome for the mum each time, rather than everyone working in their silos, working against each other sometimes. And actually that research has now shown that there's a geographical influence on whether or not you tear or not. So don't have a baby in the top of WA because they have the worst rates of tearing in Australia. Melbourne metropolitan, actually we have the lowest rates of tearing. I guess more experienced clinicians, more babies. Yeah, so they're trying to figure out how can geography change your risk of whether you tear or not, which is amazing.
Okay. So even, sorry to interrupt, Michelle.
Okay.
Even when you're actually birthing, are there any tips, like when they say that, when the baby is crowning, don't push too hard or things like that? Are there any tips at that stage from your end?
Yeah, so listening to the midwife, to the instructions, because the trauma either happens with the very quick deliveries where the muscle has to stretch too quickly and can't, so it tears, or the very prolonged deliveries where you're prolonged pushing. So just trying to find that happy medium, not too quick, so you've got time for the muscles to let go, and not too slow where you're pushing, lying on your back and pushing, because that is where the damage happens as well. So our goal is to try and have the pushing stage to be about an hour.
About an hour, okay.
Yes, that is our goal, is to try and, that's statistically, anything more than an hour is seen as a risk factor for having an injury later on. Yeah.
And do you know any average of first-time moms, like what are their pushing phases generally around?
So first-time mums are always longer, and first time is what we're aiming for, an hour. Yes,
for an hour.
The research is always done on the first delivery as well. So usually subsequent are usually quicker unless there's a complication. But yes, our first delivery we're aiming for trying to limit the pushing to 1 hour.
Okay. Yeah, great.
The other phases don't impact the pelvic floor as much. That's the key timeline we're looking at. How long did you push for? How big was the baby? Was there any instruments? There are like screening questions in terms of severity of injury.
Okay.
So in the early days following a delivery, the government is working towards improving recognising tears. So actually having a visual inspection of your perineum after the delivery by someone that knows what they're doing. Having a support team of your partner, family and health professionals, because if you do have a tear, it's going to be a bit of a slower recovery and you need more assistance. And the less you do on your feet in the early days, the quicker your recovery and better long-term outcome. And in the early days, treat it like a sports injury. So rest, feed the baby, lie down, feed the baby, lie down. Bit tricky when you have a toddler, so that's where the family and friends and partner is needed. Icing, so just like a sports injury, getting your pads, freezing them in the freezer, popping them on your perineum to try and reduce the swelling, reduce the trauma, aid the rehabilitation. Compression, you can use tight undies or double undies, or the fancy tights as well, so having more support of the perineum to help it recover, less swelling, less damage. Elevation comes back to just lying down, so feed and lie down, because even when we're sitting, gravity is still putting pressure on our perineum below. And referring on, so having that support team afterwards to help you care for your pelvic floor and to rehab it back to normal. So there is changes to your pelvic floor even in pregnancy, just from the weight and the tissue changes and carrying and the softening of your tissues. So thinking about in pregnancy to minimize strain, avoiding constipation, trying to minimize your lifting, so you're avoiding your abdominal bulge. So the more you push your tummy out, the more strain on your pelvic floor. So when you go to turn in bed, lift the toddler, cleaning and things, thinking about sucking in when you do. If your tummy is in, there is less strain on your pelvic floor. Exercise technique in pregnancy, so avoiding that bulging or coning, which I'm sure, Regina, you're all over that in the exercise. Thinking about the volume on your feet, so balance between work, home and exercise. If you've got high demands on your feet in your work, then you can't do as much in pregnancy on your feet for your exercise, so that you can protect your pelvic floor. And also footwear, more cushioning from the shoes, less strain up the system onto your pelvic floor. So even if you do end up with a Caesar, you do have a reduced risk of issues with your pelvic floor 20 or 30 years down the track, but there is changes to your pelvic floor just from the pregnancy. So even with a Caesar, you're not quite out of the woods yet.
What about prolapse? Michelle, in your experience, do you see a lot of, I'm sure after vaginal delivery, people have that prolapse symptom very quickly coming out, whereas for after cesarean section, are the numbers still there? Like, do you see women with prolapse after?
It does happen, but it's usually, if you have a Caesar, your prolapse usually is more from something of your own doing, so either constipation or vomiting in pregnancy or lifting a toddler. So people with Caesars still have prolapse, but they're less common. But I currently treat a girl who's only 17, no babies, who has a prolapse from coughing and constipation, chronic cough and chronic constipation. So yes. So prolapse is either a visible thing where you can see or feel it below, or it's a feeling, like a heavy dragging feeling at the end of the day usually.
So Michelle, whilst you're here, and you did mention about abdominal bulge, but I think our listeners would love to know from an expert in this field. So can you quickly just take us through the correct exercise technique, especially for pregnancy? Like when you, what do you mean by abdominal bulge and how it pushes a downward pressure, and what's the correct way, even when lifting your toddler? So
no worries. So if you put your hand on your tummy and you think about drawing your belly button in towards your spine, that is an abdominal contraction that is supporting your pelvic floor. Now let your tummy go, and if you push the other way, so you're pushing your hand away from your body and you're bulging your tummy out, that is then straining your pelvic floor. So that abdominal bulge is what we want to avoid. So when you go to lift your toddler, you want to suck your stomach in before you do. If you go to roll out of bed, you want to suck your stomach in before you do. I think vacuuming and mopping are a big one, and the washing basket as well. So any activity where there's abdominal pressure, it's especially important in pregnancy and postpartum, but important for everyone lifelong. When you're under strain, when there's pressure on your tummy, you want to think about pulling in. The only thing I want you to walk away from here, though, thinking is that it's not in all the time, because if you're sucking in your tummy all day long, you hurt your pelvic floor all day long, and you'll end up with a tight pelvic floor. So we're only using our tummy muscles when there's strain, coughing, lifting, cleaning. Not at rest. At rest, you don't need your tummy and you don't need to use your pelvic floor. So that's an important thing to remember. We don't use our tummy and pelvic floor all day, just when we're doing things, and then we give it a break.
I love that. And I do remember in my own pregnancy, Michelle suggested me, if you're vacuuming, put your hand on your belly. So what's the science behind that? Is it like just to be aware?
That's just my little trick, yes. Or the other one is to draw the star in your hand. So when you look at the star in your hand, it reminds you to suck in, because we're all busy women and we forget those to look after ourselves.
Okay. So you get a bit of feedback when you put your hand on your belly and then do the activity, so that it's a little reminder for you.
Not pushing out. And if someone asks you to do a new exercise, or you're doing tasks around the house, just look at your tummy. In pregnancy, you end up with a doming or a coning, so it's a bit more obvious, but in all lifetime, stomach in, under strain, it's the biggest tip to save your pelvic floor for later.
Yeah.
So how do you know if you've got a weak pelvic floor? So a common sign is leaking when you cough, sneeze, or laugh, or exercising. So that's stress incontinence. But probably what I see more of is needing to go to the toilet in a hurry, which is urgency. When you get the urge to go to the toilet, we should only have about 250, 300 mils in there, and we should be able to defer the urge to go till about 500. But if once you get that first signal to wee, you need to go, that's a sign of urgency. Frequently needing to go to the toilet. So normally we go to the toilet 7 times in 24 hours, 6 during the day and 1 at night is considered normal. So 3 to 4 hours during the day. If you're getting the signal to go more often than 3 or 4 hours, that's you're on the path to frequency. Another sign of a weakened pelvic floor is accidentally passing wind. So when you're exercising or just in normal life. Which we talked about before, the pelvic organs, it can be your bladder coming backwards, it can be your bowel coming in, or it can be uterus dropping down, or unfortunately you can actually have multiple systems dropping. So prolapse is the dropping of your pelvic organs. Difficulty with flow and fecal incontinence, so soiling or that urge, not being able to hold the urge to pass bowel motion as well. But what we see,
Sorry to interrupt. When you say difficulty with flow, is it while urinating? Like you are not able to empty yourself?
Yes, so either having trouble getting it started, so when you sit on the loo, the wee should come straight away, or having an inconsistent stream, so that it starts, stops, and then it starts again, or strong, weak, strong. That's also another sign of pelvic floor issues.
Thanks.
No worries. But what we see a lot of here is pelvic floor too tight, which is not the correct language. It's actually overworking or overactive. People with tight pelvic floor present similar to the people that have weakness. When they're so tight, they can no longer hold on to the wee, so they can get leakage, they can get urgency, and they can get pain. It can be painful periods, pain in the tummy during the day, or painful sex as well. So I probably see 3 or 4 patients a day with the too tight. So the flow that leads to the flow issues can cause more UTIs because the muscles aren't relaxing and not emptying the bladder, and painful sexual intercourse. Now, Regina, this one's for you. Who do you think has a higher rate of incontinence, athletes or mums?
Good question. I think you told me once that even athletes have a lot of incontinence, and especially female athletes. So I'm going to trust that.
Yes, but good, you remembered.
It's reassuring that it's not moms because...
No. So actually athletes have a higher rate of incontinence, and they've got this kind of issue. Usually it's because they're too tight, over clenching, but also they have higher demands. Because they're athletes and they're making more pressure from above, they need more strength to counteract it. So yes, more than 50% of elite athletes are leaking whilst playing their sport, which again is just a frightening number.
So Michelle, is the reason behind that is not awareness from early stage of training, or do you think just the sport is demanding and whatever they do, they will have to go through it? What's the reason in your view?
They don't really know yet, but yes, there's a few theories. The too tight muscles is one part. The more training, more strain, more load from a younger age, and fatigue as well. So the tissue's fatigue with repeated strain, and it's an issue. So yes, actually the rates of incontinence in athletes is higher than the general population.
Okay, that's an interesting question. I might ask that on my socials.
Yes. So this comes back to our core and pelvic floor work together. I'll just switch to the next slide. When you raise your abdominal pressure, when you have more pressure in your tummy, there's more pressure on your pelvic floor down below. So having correct technique when we're exercising or cleaning or lifting toddlers means less pressure down below. So would you like to have a try now of contracting the pelvic floor?
Yes.
Sometimes it's easier if you do it with your eyes closed. So if you're struggling to feel, trying it with your eyes closed. It's easier to contract your pelvic floor if you're sitting on something when you're first learning, because then you get some feedback because you're thinking about lifting away. So to contract your pelvic floor, you want to think about lifting your private parts up towards your belly button. A small lift. You want to be able to keep breathing at the same time. So make sure you unlock your jaw. Yes. And you want to think about soft legs. Can you wiggle your legs at the same time? It feels like a stronger pelvic floor lift if we clench our bottom, but it doesn't make our pelvic floor stronger. So the only thing that strengthens our pelvic floor is pelvic floor exercises. Okay, so let's try. Relax. Relax your jaw. Relax into the chair that you're sitting on. Or if you're in standing, just think about letting your muscles go. Soft knees. And now we squeeze and lift up, thinking about lifting our private parts up towards your belly button. Keep breathing at the same time. Keep the legs relaxed. And hold for 5, 6, 7, 8, 9. And now relax and let it go, and it should smoothly come down. So the sign of the too tight is that when you try and relax, it struggles to let go. Whereas it should, your pelvic floor, when you finish the contraction, should just come down smoothly in 1 second. So if you're at home thinking, I don't know if I can feel that or not, might be because you've got the too tight pelvic floor and you've got nowhere left to lift and nowhere to let go. So yes, that's quite a common question for the too tight people, that I can't feel it up or down. I'm like, yes, because it's so tight, it doesn't want to do anything. So if you're feeling that, focus on the relax your jaw before you think about the lift.
So Michelle, I've heard that the jaw and the pelvic floor are quite connected. Is that true?
It is true. So it's an unconscious, like a reflex back from the day. Something about we can't clench here. And when we clench here, we clench down below at the same time. I'm guessing it's something about eating and pooing at the same time, like some reflex from back in the day then, that you can't do both at the same time. So yes, they two work together. So in normal life, we want to think about relax the pelvic floor, relax the jaw. But when we use our muscles, we clench. In delivery, relaxing your jaw in delivery makes you relax your pelvic floor better. So it's quite common prompt to keep breathing, relax your jaw, because that will help your pelvic floor relax to get the baby out.
Okay. So while the pushing stage, your suggestion is to relax the face and breathe out the baby, or is it like
yes
that purple red breath?
Yes, and trying not to have it end up being prolonged pushing, because that is what, so we want it out, the baby out as quickly and as efficiently as possible, so there's the least amount of strain.
Okay, that's wonderful. Can I just ask you a question here? We had from one of our members, just because it's related to this topic. One of our members asked that they keep their jaw relaxed, but they feel like their bum muscles are involved a little bit in the lift.
Yes.
So just wanted to take your feedback. Are the bum muscles involved to some extent? Is it okay?
Yes.
Or
so we don't want to
needs to be.
We don't want to actively engage them. We want to try and let them go. So a good strategy to do that is to stand pigeon toe, like turn your toes in, because it's a lot harder to squeeze your bottom if your toes are facing in. The other prompt to help you relax your bottom is to soften your knees. But if we do a proper pelvic floor, our bottom muscles will work, but we want them working 10 or 20%. We don't want them 110%. So yes, they will contract a little bit, but we don't want that to be the focus of the exercise. We want to actively try and just strengthen our pelvic floor and not bring in our cheating muscles.
That's wonderful. I think the pigeon toe is something new.
Really well.
Yeah. And what are your favorite cues to lift and relax, Michelle?
I usually think about private parts up towards your belly button, or you could think about the muscles you'd use to stop your wee flow, or hold in a fart as well. To hold in wind, it's the same muscle. They are a sling that goes from front to back. So that is the skill of pelvic floor physio, is trying to find the right instructions that work for that person. Yes. And for people who are really struggling, we just forget about the pelvic floor and we just think about the stomach muscles. So we think about pulling a tummy in a little bit, and that makes you automatically move your pelvic floor. So I'm very lucky here that when I'm doing it, I have the ultrasound on people's tummy so we can actually see what they're doing and then work on different verbal instructions until they get it perfectly for them.
Okay. And what about relaxing? Do you have any favorite cues to help people relax?
I usually use the jaw one. That's the most common. But another common one would be, as you relax, think about opening from front to back and side to side. You want to think about lengthening and opening, stretching as far as you can from front to back and side to side. Lengthen that muscle.
That's great. Thank you.
No worries. So going forward, what exercises are safer for pelvic floor? So as we've discussed, anything with a flat stomach, doesn't matter what the exercise is. If you can keep your tummy in, it will be safe for your pelvic floor. If you have to push your tummy out to do it, then you're straining your pelvic floor muscles. Narrower squats, narrower stance, rather than a wide squat where everything is on stretch. And less load or less jumping. So walking, bike, cross trainer, rather than jumping, skipping, star jumps. I guess when you're testing your pelvic floor, as well as being symptom-free or checking what exercise you're going to do, as well as being symptom-free, I think you should assess your risk going forward. So think about your weight, so more belly weight, more pressure on your pelvic floor. Think about how many vaginal deliveries you've had. Think about, have I been constipated as a kid? Have I had a chronic cough from asthma or allergies? Or have I had back or abdominal surgery? Because they're all risk factors that mean you are more likely to end up with pelvic floor issues in the future. So as well as current symptoms, think about risk. So yes, I've done a lot of exercise in my time. I've been chronically constipated as a kid. I've had 2 vaginal deliveries, and I want to keep exercising for the rest of my life. So I am more choosy on what I do because I want to protect it for 10 or 20 years time, because I've seen the consequences later on, I guess, as well.
Yeah.
So this graph here shows you over different exercises. They've made a vaginal measurer and measured the pressure. So down at the bottom here is seated weights. And as you go up the graph, that's walking, that's lifting a toddler, that's running, that's jumping. This one is coughing. It's just about the same as jumping. So for those people with a chronic cough, every time they cough, it's the same force as jumping on the trampoline. And up above this graph, where we can't see, is vomiting. So if you're unfortunately very sick in early pregnancy with nausea and vomiting, you've had a lot of strain on your pelvic floor. So that's why if people come with symptoms or come to get their pelvic floor checked and they've told me they've either been constipated or very sick in early pregnancy, I'm like, okay, we have to be easier on your pelvic floor through the pregnancy to avoid trouble later on, because you've already had a big injury before we even get to the delivery.
Yeah. Is constipation at all covered here? Because like you said, it's very
because
big.
they did it as do an activity with a measure in, and you'd push out the measure.
And it's like a daily thing.
Force.
Yeah. That just aggravates.
Yeah, I like that graph. It's
very interesting.
You think about COVID and the flu the last few years, people have coughed a lot, and there has been some fair pelvic floor strain, and the poor girls who have coughed when they're pregnant, it's just doubly injured them. It's been cruel. So before, in physio, we use the ultrasound to see what the muscles are doing. People don't have to have an internal to know what their pelvic floor is doing, only if they're not improving, but otherwise we just do it through the tummy muscles. You can see on the screen what your muscles are doing. The other things we do in physio are bladder training. So your pelvic floor is impacted by what you're drinking as well. So looking at fluids intake, and also then looking at exercise choices. So I never tell anyone to ever stop exercising, because exercise is super important. We just got to be choosy in what we do to protect our pelvic floor. And really focusing on abdominal exercise technique when you come to physio, because if you do them poorly, more strain on your pelvic floor.
Yeah. Michelle, can I ask you a little bit more about bladder training? What exactly happens in that? Like, what do you take them through?
So bladder training helps for the people who have frequency and urgency. So your homework for tomorrow is to count how many times you go to the toilet in the whole 24 hours and how many seconds of wee. Normal is we should be able to hold on 3 to 4 hours during the day, and we should about 16 seconds a wee, which is about 500 mils. So urgency is when people are going before the 3 or 4 hours, or they've got the strong urge but they only do a little wee when they get there. So bladder training is about changing the fluids. the more yellow our wee, the more we've got a strong urge to go to the toilet. So the clearer the wee, the better we can hold on.
Okay. So would you change their fluid intake and
Yes.
things like that? Okay.
Green tea and tea are good for my business. So tea drinkers can't hold on as much as people that drink more water and clear fluids. So the tea drinkers come with the urgency.
Okay. Yeah, that's interesting.
Yeah.
Nice.
Especially green tea, because that's sold as the healthier alternative, but actually for people with bladder issues, green tea is a huge irritant.
Nice. Yeah, I've heard people, say that, like, especially related to pelvic floor, things like their physio suggested to stop caffeine intake or something.
That's right. So
but they're like, no, I'm on green tea, but still it's not improving.
Yes. Yeah. So coffee is usually a bit better than tea, but ideally we want clear fluids. Yeah. I think that was our last slide for today. So yeah.
Okay. Yeah, that's wonderful, Michelle. Thank you so much. Now, I had yeah, that's good. So I had a few questions, especially around the strengthening bit. Like, we know that mostly the focus is on Kegels and lifting. So what do people mostly do wrong, or any myths in that space that you want to bust today, or any tips? Like,
one in 5 or 6 patients have the too tight. So more Kegels, more strengthening. When patients come in and say, the more I do the exercise, the worse I'm holding on, you think, you're going to be too tight. So yes, for 4 out of 5 people, more strengthening and more exercise is the right treatment. But for some people, too many of the exercise actually makes their control go backwards. So if you're one of the people that are doing the exercise, you think, actually, I think I'm getting worse, there's probably because you've got the too tight.
Okay.
Yeah, probably the only other trick is not using your bottom on the outside. It feels like you're doing more if you're clenching on the outside, but it is not strengthening your pelvic floor. So the old 1980s lie on the floor and do the hip thrusts up and down, do not strengthen your pelvic floor.
Okay. And if people want to learn the correct way or want to know more about this, is there any resource that people can go to rather than just randomly Googling and getting half information? Where would you direct?
We're very lucky here in Australia. The Continence Foundation of Australia, CFA, Continence Foundation of Australia, has a heap of free resources because the government recognises this is something that costs the government money, and they are really motivated to help women and men. So it's the Continence Foundation. Has a social media, but a website, and then on our website we also then have a few exercise videos as well, how to do common abdominal exercises properly, so you can listen back to the instructions and follow on the video, because yes, doing your abdominal exercises incorrectly does increase the strain on your pelvic floor.
Okay, that's interesting. So also I wanted to discuss more about pelvic floor care post-birth. So what's your tip in that space? Because women are sometimes in quite a lot of rush to lose weight and get back to exercising. So what is your recommendation? Till when do you give some rest, or when can you start your pelvic floor? When can you start high intensity activities?
Okay, so in terms of pelvic floor recovery, rest in the first 2 weeks is super important. So doing as little as possible on your feet in the first 2 weeks is super important, and the science backs that up. Just like a footballer straining the hamstring, they do a period of rest after the injury. Same, we've just had an injury, a trauma to our pelvic floor. We have rest for at least 2 weeks at the start, but actually then the first 6 weeks is most of the healing. So we would be doing only light walking, minimal strain on our tummy for the first 6 weeks. Then from 6 weeks to 12 weeks, we're still in recovery. We look okay on the outside, but inside it is all still changing. Our muscles were overstretched to 3 times their normal size. They don't shrink back quickly. It takes time. And if you're breastfeeding, the tissue healing is actually slower. So we need to be more careful because of the hormonal changes. If you're feeding, the recovery is actually slower as well. So 0 to 6 weeks, rest, light activity, 6 to 12 weeks, starting to do more normal things, but trying to avoid the heavy strain, the heavy exercise, the vacuuming, the lifting, the large loads of washing, the lifting the toddler. And then from 12 weeks to 3 to 4 months, or so from 12 weeks to 4 months, then we can start introducing activity. But it is really an individually based recommendation as well, because depending on your demands at home versus your delivery versus prior risk factors and things as well. So that's a general guideline, but it can be different for every people. But I spend most of my life saying, slow down, it's okay, do less and you'll have a better long-term outcome. Doing too much at the start and too much strain, slower recovery in the end.
That's really good advice. Also, what's your suggestion? Like, should women essentially see a pelvic floor physio? Because sometimes you don't get an idea about how far have you recovered and are you really ready to go after 6 months or 8 months. So when should women actually go and see a women's health physio after they have delivered? What's the best time? And
at least around the 6-week check, but sometimes when we have seen people in pregnancy and they already have issues, I say as soon as your brain is functioning and you can absorb instructions again, come in at the 2 or 3 week mark and I'll remind you to slow down and we'll check your pelvic floor or abdominal strain. But usually traditionally it is 6 weeks, but if you have issues or you want to get started earlier, then 2 or 3 weeks is okay as well.
Okay. And say you're okay by that 6 months mark and you feel like you're probably ready to go into some activity. What are some signs you would recommend to look for as you are building up? Are there any specific signs to look out for and then take a step back if you're noticing those?
Yes, so it's usually after activity. While you're doing the things, normally there's not too many symptoms. Sometimes if there's leakage, that's an obvious one, but it's usually after the activity. So after you've done some exercise, if you're struggling to hold on to your weight afterwards and you've got that urge to go, or you've got the heavy prolapse feeling after exercise, okay, it's a sign you need to slow it down. So not just doing it okay at the time, but what happens later that day? Can I still control my weight and have I got a heavy feeling down below?
Yeah. That's wonderful. Thanks for that tip. Now, coming to our last bit, Michelle, which is my favorite part of this chat. What's your number one tip for pregnant women and women who are going into birth and also postnatal women? How should they care for their pelvic floor? So what's your number one tip? Because these are different categories. So
I think the main thing, well, can I have 2?
Yeah, of course, we love that. You can have 10.
I think understanding what can happen in delivery beforehand. So education, yes, it's awesome that you're doing this education sessions, Regini, and actually raising the topic, because yes, unfortunately, most people learn a lot more after they've had an injury. So that education beforehand, and also remembering that your abs and your pelvic floor work together. If you're doing the right thing with your tummy, you are more likely to protect your pelvic floor.
Yeah, that's wonderful. And do you have any tips for postnatal moms who go quickly? But you did share a few tips on things to look out for. Slow down.
I wish we could see down there. If we could see what was happening down there and the damage down below, I think that would motivate us to slow down a bit more. But because it's hidden and we can't see, yes, I think sometimes we think, oh, well, we look okay on the outside, we'll be okay. But it takes time to heal underneath. And we're trying to protect ourselves for the future.
Yeah. And is it after menopause that your chances of pelvic floor weakness come up again?
Yes. So over our lifetime, we build it up, and then in our 20s and 30s, we have children and our pelvic floor declines, and hopefully we recover from that. And then, yes, once we hit menopause, then it's a steep decline because of the hormonal changes. It changes the tissue quality. So quite often people who get through having babies fine come to me in their 50s and say, out of nowhere, all of a sudden, things have just dropped, or I can't control. And then when we talk back to what happened in their baby's deliveries, you think, oh, you had forceps, or you had that prolonged pushing, or you had lots of babies close together and you didn't recover in between. And they got through all that time fine, and then all of a sudden it catches up with them later on.
Yeah. So I actually read something on one of the very good websites. I can't remember which it was, but they actually said that every woman should do pelvic floor exercise like daily.
Yes.
Is that a general recommendation? Of course, considering you're not on the over tight or is that hypertension?
That's right. So yes, I would recommend that. But again, knowing if you're too tight or not, because the too tight patients, I usually say to them, I'm happy if they just do it 3 times a week to maintain it. Yeah.
Yeah. That's wonderful. Thank you so much, Michelle.
No worries.
I personally learned, I personally learned so much from this chat, and I'm very confident that people who are listening to this chat would have got like so much out of it, and especially those graphs. They were so interesting. So thank you so much for your time.
No worries. Thank you.